Welcome to Roots Dental Academy. Hope you are in best of your health and spirits. We are here with an informative lecture on the principles of health education. Health education is an active learning process which aims at favorably changing attitudes and influencing behavior with respect to health practices. The same principles which govern any learning situation are inherent in the process of health education. Health education is vital to the practice of prevention. It is the channel for reaching the people and alerting them to the doctors' services and to all other community health resources. The first principle of health education is credibility. It is the degree to which the message is perceived as trustworthy by the receiver. It should be scientifically proven, based on facts, and should be compatible with local culture and social goals. Second, interest. If the health education topic is of interest to the people, they will listen to it. The health educator should identify the felt needs of the people and then prepare a program that they can actively participate in to make it successful. Felt needs is the requirement of or care as determined by the patient or the public. Third, participation. The health educator should encourage people to participate in the program. Once the people are given a chance to take part in the program, it leads to their acceptance of the program. Certain methods like group discussions, panel discussions, etc. provide opportunities for people's participation. Fourth, motivation. Motivation can be defined as the fundamental desire for learning in an individual. Motives are of two types: primary motives and secondary motives. The primary motives in life are inborn desires and or forces which drives an individual into action. Food, clothing and housing are examples of primary motives. The secondary motives are desires that are the results of outside forces. Examples for secondary motives are gifts, love, a word of praise, rewards, etc. Health education can be facilitated by the motivation provided by the desire to achieve individual goals. For example, for a teenager, aesthetics might be a motive to take care of his or her teeth, whereas for an adult, the expenses of undergoing restorative care might be the motivating factor for taking care of his or her teeth. Fifth, comprehension. It refers to the level of understanding of the people who receive the health education. The health educator should first determine the level of literacy and understanding of the audience and act accordingly. Words that are strange or new to the people should not be used. For example, a statement saying eat food items which are non-carcinogenic may not be comprehensive to the layman. A better way of explaining would be avoid foodstuffs which are sweet and which stick to your teeth like toffees and pastries. Eat food items like fruits and raw vegetables which, in addition to being healthy, also help in keeping your teeth clean. Sixth, reinforcement. This is the principle that refers to the repetition needed in health education. It is not possible for the people to learn new things in a short period of time. So, repetition is a good idea. This can be done at regular intervals and it helps people to understand new ideas or practices better. This principle can be called as a booster dose in health education. Learning by doing. Just by listening to new ideas or seeing new things, it might be difficult to implement them. If the learning process is accompanied by doing the new things, it is better instilled in the minds of the people. This principle is based on the famous Chinese proverb, and I quote, "If I hear, I forget. If I see, I remember. If I do, I know." I unquote. For example, it is difficult to even remember the method of toothbrushing if the procedure is only heard on the radio. It might be difficult to master the act of proper toothbrushing even by watching a demonstration. However, after the demonstration, if it is practiced under the guidance of an expert, the proper method of toothbrushing can be learned. Eighth, known to unknown. Before the start of any health education program, the health educator should find out how much the people already know and then give them the new knowledge. The existing knowledge of the people can be used as the basic step upon which new knowledge can be placed. For example, a health education program with the aim of introducing a toothbrush to a rural population will be better appreciated if the communicator starts the program with, "What are you using to clean your teeth at present?" and then going into details like, "Why are we using it?" and then connecting it to the toothbrush and then providing details about the toothbrush. Ninth, setting an example. The health educator should follow what he preaches. He should set an example for other people to follow. For example, a health educator who participates in a program highlighting the ill effects of tobacco should not be seen smoking, since it sends a wrong signal and the seriousness of the situation is lost. 10th, good human relations. This principle states that the health educator should have good personal qualities and should be able to maintain friendly relations with the people. The health educator should have a kind and sympathetic attitude towards the people and should always be helpful to them in clarifying their doubts or repeating what is not understood. 11th, feedback. For any program to be successful, it is necessary to collect a feedback to find out if any modifications are needed to make the program more effective. 12th, community leaders. Community leaders can be used to reach the people of the community and to convince them about the need for health education. The leaders can also be used to educate the people, as they will have a rapport and will be familiar with the people of their community. The leader will have an understanding of the needs of the community and advise and guide them. Health education for rural people can be achieved through the head of the village, whereas school children can be approached through the headmaster or school teacher. Conclusion. Education as a viable intervention for the maintenance of health and prevention of disease has received increasing attention in the last decade. In public health and medical care, the goal of most of the educational programs is some kind of behavioral change. It is equally important that all public health and medical personnel have a grasp of basic learning principles and the application of these principles to their specific settings. Thank you.